welcome to the Positive Future PainFree Podcast. And today we have Sara who's going to be talking to us about homeopathy. And where did I meet Sara? And I meet so many amazing people like yourself, Sara. And where did I meet you? And I was just thinking, oh my gosh, it was just a few years ago at the Sun and Moon Festival in England, which is an amazing week-long event with all sorts of natural therapies and all sorts of lovely things for health and healing, well-being, and it's a really amazing community. So I do recommend it to everybody. But that's when we met, and I came along to your class, and I thought I knew a bit about homeopathy, but not in great detail. I was a bit hazy about the details, but I knew it was something about understanding what's the character and messages of your illness, which I know you're going to be talking about in detail. So you came across so clear, and you really explained things really beautifully, and you showed us how to use homeopathy in a very easy, practical way. So I'm delighted that you've said yes to come on the podcast. And Sara, can you tell us a bit more about yourself and how did you get into it all? Who are you?
Sure. Hi, Althea. Well, thanks for inviting me on the podcast, first of all.
Okay.
And yes, just a second that Sun and Moon's an amazing festival, and it was lovely to meet there and to be able to discuss, having come to your workshops, a couple of the similarities in terms of what we do. So I first got into homeopathy. The first time I used it was when I went traveling, many years ago, in my 20s, and my friend that I went with suggested that we took with us a homeopathy kit in case we got into any scrapes or illnesses, or because just didn't know what to take with us in terms of medical assistance going to Asia. And that was the first time I'd ever heard of homeopathy or seen it. And we took with us one of these remedy kits that you can get
Yeah.
from the pharmacies. And then I started using it for my daughter and myself kind of in my late 30s. So I had my daughter, and unfortunately then I got ill with a thyroid condition. And so it was a real struggle. I tried all kinds of things, tried the doctors, the conventional meds, nutrition, did all sorts of things with my diet, still wasn't feeling as I should. And I decided to consult a homeopath. I can't really remember, to be honest, how that came about. It might even have just been that there was a poster of the homeopath in the shop where I was going to see the nutritionist. I honestly can't remember. Anyway, went to see her. And so I think then combined with everything else that I was doing, I started to see changes. And it was a gradual thing. It was difficult to know what it was that was helping, but something was helping because it was getting better. And then my daughter got oral thrush, and she was about 3 or 4 at the time, and we went and got antifungals, and it went away, and then it came back, went away, came back, until she was in such a state that she couldn't really eat. She had blisters all over her mouth, and I just thought each time we were getting the antifungals it was getting worse. And I thought, well, why don't I take her to the homeopath that I'm seeing? And it went away, and it did come back. So we used, she prescribed the same remedy again, and we did have to see her 3 times over the space of a few months for it to be gone completely. But that was really where I saw homeopathy working in a really visible way, I guess, because with me it was a very gradual process, but with her it was really like, wow.
It's obvious.
It was obvious because you could see that, tongue was really white, coated, blisters all over her mouth, and then it wasn't. And we didn't need to use any of the antifungals. And, she's never had that again since that period. She's seen a homeopath since when she was a little bit older for sort of anxiety and, difficulties at school. But yeah, so during that time, I was invited by my homeopath to go on a weekend course. She was running a workshop for interested patients, I guess. There were about 4 or 5 of us, and we just did a few hours each day where she went into more detail. I'd obviously shown interest in what it was all about in our sessions. And I was at a period in my life where my daughter was just starting school. I was a teacher previously, languages teacher. So I've been doing teaching again, after I'd had her. Well, I was fed up with it, to be honest, and I was at the point where do I go back into it full time? Didn't really want to. And then this course that I did with my homeopath, I just had one of those light bulb moments when she handed out a prospectus for her college where she taught, and I thought, my God, I could learn something new. Maybe I could learn this. And so that's where it
Oh,
started.
it is
Just like, wow.
synchronicity.
Yeah, it
Love it.
was just like, wow, maybe I could do that. I didn't realize at the time how difficult it would be, that it was going to be 4 years of a really hard work because I was a single parent. I was having to manage finances, having to do my study. It was an in-depth course. I had to go once a month for a weekend and then do about 12 to 15 hours a week study. It was amazing in terms of the first time ever I was really learning something I was fascinated by. School was, I just did what I needed to do. Law degree, I did it because I didn't know what else to do, etc. So it was the first time I'd really loved studying, but it was still hard to juggle everything. And so, yeah, so then I qualified in 2020. And so I've been in practice since then and gradually taking over with homeopathy from teaching. So I'm kind of doing a day. I'm just like so I'm doing a day more homeopathy.
And what does it feel like, the difference of you were doing a job and you did all the studies and you got that teach job and now you're doing something you love? What's the difference in your world? What
Oh,
difference?
it's just amazing. I feel like I'm doing something that I was meant to do, I suppose. I mean, it wasn't like I wasn't good at teaching. I'm still doing the teaching twice a week, but the education system's fraught with so many difficulties. I find it really frustrating the way. I won't go into all that in detail now, but
That's
you know,
another whole podcast.
yeah, exactly. Yeah.
And I remember when I
Go.
first started my career, I remember in my training, one of my teachers' peers, they said that you don't you don't live to work, you work to live. And I thought, well, that's nonsense. I mean, you're spending the entire time of your life working all day long and then some. So why not love what you're doing? And I thought that was all wrong. Gosh.
Absolutely. Yeah. 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 I mean, I did have a period, I did leave teaching and I went and lived in Spain and I led walking holidays. And so I did that for a few years because I knew it wasn't for me just being in a school teaching the whole time. But that obviously is not a sustainable kind of life when you have a family.
Yeah.
So
So then you got to qualified in homeopathy,
yeah.
and how's it been since? This has been how many years now?
So that's 4 years. So 4 years. So I qualified in summer 2020.
Mm.
So yeah, so it's just been gradual. I guess every year I see double the amount of patients. I'm able to see more because it takes me less time to do the analysis. So it kind of seems to be growing really organically in the way that it should. In
I
terms,
like I like your manner and the way that you understand and talk about it and teach about it. So can you show us how it works? What goes on? Would that be
so
okay?
it's a little bit difficult to know what people will want to know. So I hope that I've pitched it kind of so that there's a little bit about the philosophy and how it works, but not too much, because that can get a little bit dull for people who aren't
Okay.
homeopaths. But just a little bit. But if there's any bits that don't make sense and you want to know more, come in and stop me and ask. But I've also sort of geared what I'm talking about a little bit towards pain because obviously you're doing the pain-free method and your clients, people who are watching this, are interested in pain relief, pain management. So I'm
Brilliant.
starting off talking just what it is. A lot of people don't know what homeopathy is. They think it's herbal medicine and it's different. And then I'll talk a little bit about the difference between acute pain, chronic pain, and then how we treat those. So shall I share my
Fantastic.
screen
Yep, go ahead. It
now?
sounds perfect, like a great balance.
Um, there we go. So can you see all that
Yep, that's
clearly?
that's perfect.
Great. Okay. So just to start with, so what actually is homeopathy? So it's what we call a holistic medicine. And so what we mean by holistic medicine is that we see the mind and body functioning as an integrated whole. So when we talk about disease, we're not talking about an isolated part of the body or an isolated disease just affecting one part of the body, although that's how it appears. We're talking about it being an expression of a disharmony within the whole body. And so with the homeopathy, what we're doing is we are sending a message with the medicine to which will trigger the body's own healing mechanisms to remove symptoms and then restore health. So in the difference then between the allopathic medicine or conventional medicine, where it's the actual medicines themselves that are helping the symptoms to be relieved, what we're doing is we're trying to get the body to actually do that. So the body, it's amazing and it can heal itself. We heal ourselves all the time from our colds and coughs and things, but sometimes it gets stuck and it needs a little bit of a kick or a little shove to do what it needs to do. So that's why we use very highly dilute doses. We don't use huge amounts, lots of, then we don't need to be using it forever because we're giving the message to the body. Once the body's got that message, it will do what it needs to do. We then may need to remind it from time to time, but generally it's not a medicine that we need to continually take.
So it stimulates the body, gets it going, and the body takes over from there.
Exactly. And so that's why we use what we call the minimum dose. So once that's evident and it starts doing that, we stop the remedies. And then if there's a relapse where like the body forgets what it's doing, then we put another remedy in to kind of remind it.
Because there's often emotional root causes, there's often long-term, lifelong triggers and patterns that we are, isn't it? So the body's sort of, you're in a pattern of disease maybe.
That's
so
it.
you might need a few times to kind of trigger you back into.
Exactly. Yeah. So we look at each individual specific set of symptoms. We look at how they experience them. So I've just had a patient I've just finished with just now. And so, she's talking about tearing sensations, and it's as if someone's tearing her apart, for example. So things like that are really interesting for us. And we look a lot at the language that people use and how they're experiencing their pain. And also then when we're prescribing, we're taking into account the overall level of health. So how strong that person's vitality is. And that will help us to decide on what potency and what dosage of the remedy that we're going to give. And so, one of the huge advantages of homeopathy is that there aren't side effects because of the very minimal dosage. Occasionally we get what we call aggravations, which is where somebody gets very slightly worse before they get better. But generally it's not, we don't have the same kind of side effects as you can get from a lot of other drugs.
Because it's not something you add to, it's a stimulator, isn't it, of your own system.
Exactly.
I call it the healing crisis in massage world.
Yeah, exactly. We talk about that as well. Yeah, we use that.
It may have been sort of something that's been shoved under the carpet for many years. So as you start to release things, of course, all the reasons it's there starts to gush out, think, oh, it's freedom.
Right. That's right. Absolutely. Yeah. So where does homeopathy come from then? So it's been around for around 200 years. And according to the WHO, it's the second most widely used system of medicine in the world. So it's huge in Europe and India, particularly. And the person who discovered it or found out about it was called Samuel Hahnemann. He was a German doctor. And the principle that he discovered was the law of similars. So where like treats like. And in fact, going back to Hippocrates, like way back, he also talks about this law of similars, where something that can harm a healthy person can heal a sick person. So an example would be, for example, the homeopathic remedy coffea, which is made from coffee. So it's like opposites, isn't it? So you drink lots of coffee, you're going to get agitated, you're going to find it difficult to sleep. So whereas with conventional medicine, they might give you a drug to induce sleep, larger doses could potentially cause side effects, could cause dependency on that sleeping drug that they're giving you. The treatment by similars is if we give the coffea, then in large quantities, that would cause the coffee would cause sleeplessness, but in a minute dose, it will result in a natural sleep. It's like the opposites, but because
Mm.
we're just using a tiny, tiny amount. Or another example is onion. So the allium cepa is the name that we give to that in homeopathy, coming from the Latin. And so the symptoms, somebody with stinging, watery eyes, runny nose, they could get that from an onion, but they might get that when they're not cutting up an onion, for example, in hay fever. And so we look at those symptoms, what in the natural world would cause those symptoms in a healthy person if they were to have that. So if somebody's chopping up an onion can cause those symptoms. So if somebody gets those symptoms without cutting up an onion, we can use the homeopathic remedy called, which we call like potentized onion, and that can
Mm.
relieve those symptoms in hay fever.
I
So
wonder, I wonder whether it's like equivalent to putting a mirror up in front of somebody, because I know with my method it's kind of reflecting to somebody back, and then
yeah,
it sort of recalibrate because you don't just live the experience of the disease or the symptom when you get it reflected back at you in some sense.
yeah,
You can see yourself, and you can. It's like a wake up to come back
yeah,
to
yeah.
balance again.
Yeah, exactly. So one of my teachers would call it a mistunement. Is like there's a mistunement in the body, and your that the remedy is then retuning.
Mm.
And another teacher also he talked about the mirror. He has a thing called the magnet and the mirror.
Ah,
I don't want to try and go into his explanation of that philosophy. I can't remember precisely, but he would use that terminology. Yeah,
interesting. I
yeah,
never, I'm so glad I got you onto this podcast because I didn't know the details of, I didn't understand homeopathy. So this is great to hear it. And what I understand about healing, I've been a therapist 30 years, and I hear the similarities in all different methods, all
yeah,
holistic
yeah.
methods. There's a reflection, even when we had our original chat, wasn't it? It's like, oh, that's what I'm doing.
Yeah, 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 absolutely.
It's different methods, but it's the same principles.
And we can talk about that a little bit more when I get to the specifics of pain, and yeah, the similarities with what you do. But so
Mm.
just a little bit about the remedies themselves. So we've mentioned already that we're using minute doses and ultra high dilutions. Now, I'm not a physicist, but there are investigations that are going on now as to how the homeopathy can be working, and it's in the field of ultra high dilution physics. So anybody who wants to look into that, there's lots of information out there about that. I'm not an expert in the hows, but it's something to do with the water molecules being attracted to the molecules of whatever we put into the water when we're diluting it, and crystals being formed. And the crystals are of different shapes depending on what the substance is, even though it's only a tiny amount that's being put in to the water. And then they are conveying the information to the body that's triggering the healing. So, like I say, I'm not the best person to explain all that, but you can look into that. And then it's also what we call potentized, the remedy. So those ultra high dilutions, while they're being diluted, um, the remedies are what we call succussed, which means they're vigorously shaken up and down many times. But again, I won't go into that in too much detail. But um,
I heard something similar in urine therapy. Not that I don't do
okay,
urine therapy myself, but
yeah.
I've heard a lot of talk about it. That when you are sick, um, I'm not recommending this unless there's
Yeah,
somebody wants
I
to.
have heard this before actually, Althea. Yeah.
But if you put a drop of your own wee on your tongue, your body reacts to it and understands what's the problem, and
Yeah.
it reacts in a positive way. I don't know exactly. It sounds like a similar kind of thing.
Yeah, because it's only a tiny amount, isn't it? And it's just again giving a message. Yeah, I mean, if you think about everything going on in the body, things are so tiny, aren't they? Think about hormones and they're so tiny, aren't they? That we
And
don't.
everything's connected, though, isn't it?
Yeah, yeah,
Consciousness, the body, every part of your body, the blood supply,
exactly.
your spirit, everything's connected.
Yeah, yeah. So where do we get them from? So the majority of the remedies are made from plants. So that's where people think, oh, it's herbal medicine, but the differences are in the way that the plants are used. So like we only, one part. So some are made from roots, some are made from leaves, some are made from the berries. But again, it's only, you would need such a small amount to make millions and millions of remedies because of this, the dilution. So there's remedies made from minerals, so different kinds of rock, chalk, with all sorts of minerals. So and then a few of them are animal sources, but again, it's not. It's like because it's such a tiny amount. It's not like we're harming animals in making the remedies as such. So we might have squid ink is a remedy that we use a lot. It's called sepia. We use that a lot. It's a bit
Oh, wow.
really good for hormonal imbalances. We have one called apis, which is made from a bee sting. And so that's obviously really good for people who react badly to bee stings.
Yeah.
But it can also be used for overreactions to other things, like so it might be, an allergic reaction, for example, that's not from a bee necessarily, but it has a similar so similar symptoms to what somebody would get who overreacted to a bee sting, then we might use that remedy to help them.
Could it be non-physical things as well? An overreaction emotionally, overreaction mental state, overreaction trauma?
If there's so with apis, there's a real busyness. So if your overreaction was to be super busy, like a bee, for example, then potentially, yeah, yeah.
Mm.
So we've got over 3,000. I mean, those remedies can be made from anything. In practice, most of us use 200 to 300 in our daily practice. So the homeopathic consultation, after we've had that, it's a case of sort of piecing together all the information that somebody's given us and deciding which one is the best fit for them at that particular time. So the way that they are tested is on healthy human volunteers, and they do things like called provings. So going back to Hahnemann, who was the first, he was the one who discovered homeopathy. So he would get together a group of people and he would give them all a remedy that he decided he'd like to try and use, and he would see what happened. So they would, over a period of time, so nowadays it's a month, everybody takes it, everybody goes away, they don't speak to each other, they write down everything that's happening to them. So that's on all levels: physical, mental, emotional, their dreams, everything that's affected. And then they come back together after a month and they collate it all. And then they look at what were the common things that happened to them all. So what were the common pains, what were the common emotions, etc. And then it all gets written up. And then that makes like a picture of that remedy. And so then when we have patients who have things, wrong with them emotionally, mentally, physically, that match that picture, then that would be the remedy that we would choose for them.
And I've heard sometimes homeopaths give one thing, but then it doesn't quite work, so they try another thing, and it's like a detective thing. It sounds like.
Exactly. That's what I said when I said at the beginning. I didn't think I'd chosen an easy path. It's because it's not like, oh, you such and such has got a back pain, so we'll give them this. Somebody's got arthritis, so we'll give them this. As we'll look in a few minutes, when it's acute things that happen. So you bang yourself on your finger with a hammer. There's specific remedies you can use. Something that sort of comes from the outside, or you tread on a rusty nail or something like that. But when it's more complicated things, it's like you say, it's like detective work. And the longer someone's been alive, the more that's gone on in their lives, the more stuff
Mm.
they've accumulated. And so sometimes we don't get it straight away. We might get a close remedy, it might help certain things, it might not help other things.
Sometimes people don't reveal everything either, even.
Exactly. And sometimes we always say we do 3 sessions. So people have to commit to 3 sessions a month apart. And so hopefully by the third session, they're on the right track. So and that's a period of 2 months.
And
So
it's such a subtle technique, isn't it? I mean, I've been to homeopaths before, and they gave me a couple of little pills in a little brown packet. And I was like, "What's that going to
is
do?"
that it? Yeah, exactly. Well, that's the thing that's difficult for people to get because obviously it's
Yeah,
minimum dose. It's only it's energy medicine after all. It's not, and
yeah,
it's hard for people to grasp what's going on there.
yeah.
So
I think maybe it's the expectation of their need to this tiny little white pill,
yeah, yeah,
and then a month apart. But
yeah,
but it works, doesn't it? Which is
yeah. I mean, and it depends on like we said before, the level of health of the person, the nature of the condition. So I would generally be prescribing something once a week, maybe twice a week, depending on the potency that I've chosen. Sometimes somebody would take something every day. Um, Sometimes I might give it to them in water and then they take it for a few days and then they stop. Um,
so you really need to go and see a homeopath if you want to go down this route, isn't it? Because I mean, I've got packs of like mother and baby when I have my kids, but packs of you can buy a pack of homeopathic pills
yeah,
or
those kits, like the blue
it.
remedy kits. Yeah,
Mm.
yeah. Mm.
So I wouldn't have it. I just would take. I mean, when I had my cesarean, I had no clue what dosage. I just as I was recovering, I'd take. I just thought, well, I'm struggling. I'll take another one. I don't know.
But that's okay, Althea, in because in acute
Okay.
situations you need them more. So,
Okay. Is
when
it all
it's
right then?
yeah, when it's an acute situation, you take depending on the severity of the whatever it is that's happened, you take them more frequently. Because if it's something that's affected you really strongly in that moment, the remedy will kind of get used up, we say, like quite quickly, and the body will need constant messages, so it can be every 10 minutes. Even somebody's had a car accident and they're waiting to go to hospital and you happen to have a kit with you, you can give them remedies, every 5-10 minutes until they're in hospital having whatever
Oh
surgery,
wow.
whatever it is that they need. Whereas
Hey,
if it's a long-standing condition and someone's had something for many, many years, it's a message that the body needs, and then it's going to take it time to start reacting to that remedy, and so you don't need to repeat it so often.
okay.
Um,
And
so
then you've got this thing that says they don't create dependency and don't interact with other medicines. I think that's great to hear. And
that's
also,
right. Yeah, yeah.
you can't overdose in this stuff. So if I took
No, you can't
many,
exactly. And there's stories of one of the guy who ran the school where I studied, the homeopathy school, when his father also was a homeopath. And when he was little, he tells a story that he found some of the remedies, and one of the bottles of them. And so because they're made with sugar, they're sugar pills that we then put the actual
well,
liquid remedy, we put a couple of drops
yeah,
of that. So he had the whole lot, and it's fine. It's that
well,
one pill or 100 pills. It's the same thing if you're taking it at once because it's the same. It's just the message to the body. So
fantastic.
it's not dangerous.
Sorry,
No,
I
I was
was
just
just
saying it's not dangerous in that way,
that's
fortunately.
great because when my kids were little, I use all natural things with my with our household, my kids, and
Yeah,
yeah, we found the arnica. The arnica kept getting empty. Quite, Mum, I need an arnica. Mum, I need an arnica. And
yeah.
Mum, I was like, yeah, but they couldn't have overdosed, so that's good to
I
hear.
mean, you wouldn't want to be constantly taking it every day for too long, without needing it, because then you're giving a message to the body that something, that it needs to do something, and when it doesn't. So, you don't want to just take it all willy-nilly.
Yeah.
But at the same time, it's not because of the minute doses, you're not going to be getting dependent on it like you can on others. And equally, yeah, when people come to see us and they've already taking other medications, then they just keep taking those medications. We just need to adjust our dosage to make sure that they're getting enough of the homeopathy, because they're taking the other medicines. So we just would give it more frequently, for example, then. But we would never say to anybody, don't take your medicine, or you can't take homeopathy with that medicine. So, in that way, it's quite good for people that they don't need to make a choice. Then they can keep going with
Yes,
what
because
they're doing.
this is a common question, isn't it? And to not interfere with other medications.
Yeah, yeah. And then, sometimes over time people do decide to reduce the whichever medication it is that they're taking if they're feeling better, but they would do that in conjunction with, in conversations with their GP or consultant that's prescribing those.
Yeah.
Okay. And so now we come to acute versus chronic pain. So acute pain, what we mean by that, as I'm sure everybody knows, is it's something that's short-lived. You're either going to get better from it or you're not. It's coming from the outside. So, it's something that's happened to you. It's not something that's happened gradually over time from within. And we can have more specific remedies. So, for example, you're talking about the kit that you've got at home. So this is where the kit is brilliant for people to have at home, and that they can have a go. And if they get it wrong, it doesn't matter. It's not going to do them any harm. They can try another remedy. We always say try three doses, sort of a couple of hours apart. If it's not helping, then try a different one. And there's little books within the remedy kit that guide you as to how to use them. And then obviously there's lots of other books that you can get for home prescribing.
I think it's great to listen to you as a homeopath, because I'm getting a sort of intellectual understanding about what's the mechanism of homeopathic treatments, and I think that makes all the difference. Because when I used them before, I just looked through that little book and think, oh, what kind of cold is it? Is it phlegmy? Is it coffee? What's I think it's this and I think it's that. I'm not sure, but having a concrete understanding about what's the mechanism, what's it doing, I think that makes all the difference as well.
Brilliant. And on the next slide, I'll show you a few remedies that that you can use in acute situations, with different types of pain. So just to say quickly, so the chronic illness, that's something long term. It's something that will have to be healed gradually. It's something that's happened from within. So it's either something that's happened because of something we've been doing, like drinking too much alcohol or whatever it might be, or the type of stressful lives we're leading, or it might be something genetic, something hereditary. And so for those kinds of conditions, it's not a good idea to try and treat yourself, because you need the follow-ups. You need to see what's, to take a remedy, you then need someone else to assess a few weeks later how it's helped, what's helping, what's not.
Your experience, and to see the patterns, because it's not always easy, especially if you've had it a long time. It's a lot of people say, oh, I can't even remember what it was like before this illness.
Exactly. Yeah. And it's funny, sometimes people come back and you say, oh, how's the, whatever it might be, and they say, oh, fine.
Thing.
Completely forgotten about the fact that was even an issue, which is brilliant when that happens. So we talk about then individualized treatments for people depending on, like I said before, it's a bit like fitting a jigsaw together, or the detective work. And we're looking at their what we call constitutional state. So what is their state at the moment? And we look at lots of aspects of their lives as well as just the specific thing that they've come with. And I'll talk about that in a few minutes. So to look at the acute and chronic remedies that we use, before we do that, I just thought we'd look at what pain actually is, and then how we, as homeopaths, whether you're doing it for yourself for acute pain, or whether a homeopath is assessing sort of how we go about doing that. So as you will know, people often think of the pain as something negative. Nobody wants to have pain, but actually it's a protective thing, isn't it? If you think about it,
Yeah,
because if we didn't have it, we wouldn't survive for very long, would we? If we didn't know that we were burnt, or we didn't have that instinct, so it's kind of
yeah,
nature's way, isn't it, of expressing
totally.
the patient's needs. We'd be so vulnerable, wouldn't we, to injuries and
Yeah,
cuts and etc. We didn't have pain.
yeah,
I think it's quite good in a way to look at it in that way, that it's the body doing what it needs to do to protect the person, isn't it? By
yes,
bringing you
definitely.
those sensations. But it's just then when it becomes long term and we have it for a long time, that we don't want to have it there anymore. But when it
Definitely.
first comes about, obviously.
It is because it might be emotional, it might be just literally wear and tear or hereditary, as you say, and it might be emotional. So that's say like it's a hip pain or something.
Mm.
If we make that go away with painkillers or operations, but what about the creation of it? The
Yeah,
reason
yeah,
for that.
yeah. And we're not dealing with that, are we?
Yeah,
Exactly.
and the pain itself is stopping you moving because if you keep moving, you're going to cause more damage. It's
Exactly.
saying,
Exactly.
stop, look at this thing.
Yeah, yeah. Yeah, so we talk about in homeopathy about symptoms being our friends, because they're doing that for us, aren't they?
Yeah,
So when we're assessing and looking at how to decide on what remedy to give, or when it's for ourselves what we need, the descriptions of the pain are really important. So, what type of pain is it? Is it a tearing pain? Is it a cutting pain? Is it a stabbing pain? Is it, sharp pain? Is it an ache? And that will help us decide which remedy. Equally, what kind of sensations there are. So somebody might describe their pain as like, somebody is doing something to them, somebody's tearing them apart, or, those sorts of sensations. Or it feels
yeah,
like I've got a vice around my head. It feels like I'm trapped in whatever it is, something like
yeah.
that. That's really helpful to us as homeopaths in terms of what language people use to
And you
describe.
can't fix that with a pill. You can't fix that with make it go away. You can't fix your feelings or what you've been through.
Yeah. And then we might link, so then we look for where certain sensations come about in other areas. So we might notice in taking somebody's case that they might mention that, the head, the pain feels like they're trapped in a vice, and then later on when we're talking about something else in their life, um, they might mention something else about, I'm so sorry, my daughter's making a really loud noise. I'm just going to ask her to stop. So, Noah, could you just not talk, sweetie, please, for a minute? Thank you. Or just whisper. I'm just doing a podcast. Sorry about that.
Life of real life.
Yeah, she's just come in from school. Um, so they might talk about how they're feeling in a certain situation, in a relationship, or at work, or whatever it is. And again, they might use that same language that describes their pain, that might describe their situation, and that can be really helpful in guiding us towards a remedy. Um, Equally, we're looking at the modalities. So what that is what makes the pain better, what makes it worse. Um, is there a known etiology, which is what caused it when it first happened? And that could be physical, like a car accident. It could be emotional, that ever since the death or something, then they've had this particular pain. Um,
And so would you be listening to that and addressing the emotions and feelings they've had, or you stay with the physical and you treat the physical?
so we're treating it all together. So, but we'd be looking at, so if it was really obvious that they'd had it since a grief, then we take that into account. We'd be looking at remedies that have ailments since they've had a grief. So there'd be a list of remedies that would be getting certain symptoms once after having certain, or a shock, or whatever emotional etiology it might be.
Mm.
So as we've said, acute pain, home prescribing with your kit is absolutely fine, using the books. chronic pain, you need to consult a homeopath. And so here we've got just a few of the remedies that we use in acute pain. So these are remedies, almost all of these, if not all, would be in your kit that you've got. So we've got the remedy names here, and they're almost all of them plant remedies. These are the types of pain. So, if somebody's hurt themselves and they're describing the pain as an ache, it's like it's bruised, and they're telling you, please not to touch it, go away, don't touch it. Then everybody's heard of arnica. That would be the go-to remedy, and it can be it's an amazing remedy. You can use it in really, really serious situations, not standalone necessarily. I keep talking about a car accident, but for example, you could use that as well as the treatment that you're going to get at the hospital, and it would speed up the healing hugely. Staphysagria is a remedy that we use if the pain is like a cutting pain, and the patient might describe it as if they've been cut by a razor or a sharp knife. And there's often an emotional element to a pain that needs staphysagria. We use it a lot after an operation, for example. If somebody feels like the operation's been really invasive, or they've had to have, so somebody's had to have a cesarean or something that they didn't want to have, some kind of invasive procedure, staphysagria would be really good. Ledum is a remedy that if you were to stand on a nail, or you were stung and you can see that an entry point, like a sort of puncture wound, then ledum would be the one to go for. And that would be better for ice cold applications. So if that's what the person is wanting, they're wanting an ice pack on it, then ledum would be the first one to use. Cantharis is a remedy. That's one of the few remedies that isn't a plant remedy. So that's made from the Spanish fly, and that's a remedy for burning pains. So it's also the main remedy for cystitis when the symptoms are burning pains. And again, it's better for cold applications. Bellis perennis if there was a blow to soft tissues or soft tissue damage.
Daisy.
Pardon?
That's Daisy.
Yeah. Well, the arnica is a type of daisy, isn't it? Bellis perennis
Yes.
is a type of daisy. Yeah.
Yes.
And so, so for example, in the eye, and again, cold applications better. Hypericum is the nerve remedy. So trapped fingers, your child traps their fingers in the car door, that awful situation. Hypericum, amazing, because the fingers have got lots of nerves in the ends. Grazes that are super painful, shooting pains, obviously. And the modality for that, the main one is, worse for any kind of jarring, or worse, better for lying down quietly. Apis we mentioned earlier. And then aching in varicose veins, that responds to hamamelis or placenta. So a bit difficult to differentiate between the two. So you'd have to be looking that up in your book as to how to differentiate those. Ulcers, like mouth ulcers, for example, that really generally okay until you touch it with a bit of food or another object, is nitric acid. And then Magfos. Magfos is an amazing remedy for muscular spasms, period cramps. And the modality there is better for heat. So someone who's getting bad cramps, want a hot water bottle on time of the period. Magfos is brilliant for that. So that's just a few examples. You get, I think the main kits that you can get, the acute kits, have 36 remedies in. And you get this information in the little book. So perfectly safe to self-prescribe, and you can take them, the remedies, sort of every hour, every couple of hours, depending on the severity of the symptoms. If it's not helping at all after you've taken 3, then you've probably got the wrong remedy and you need to look again. And it will give you differentiations, won't it, in the little booklet it gives you.
Yeah. So we're really looking not just the actual thing itself, like burns or aches or whatever, but you have to look at the modality.
Exactly.
Which one it is. So it's not just like we're taught that you have a cut and you put a plaster or whatever. You have to look at the modality as well.
exactly.
Like,
Yeah, yeah. I was going to say something else then. Yeah, I mean, it was sometimes we might take into account the mental state, the emotional state as well, certain things, or the person's reaction. So there's another remedy, bryonia, and that's brilliant for all different kinds of pain. The main modality for that is that don't want to move, just want to keep really still. And emotionally, they're like a bear with a sore head. So really irritable, the person who's lying still in pain, and you bring them, they ask you for something, and then the minute you bring it, it's the wrong thing. It's that sort of so you might take into the account those kinds of things as well. Sometimes you don't need to. Sometimes it's really obvious, like with hypericum or with arnica, for example. So yeah, when you're self-prescribing, those are the main things that you're looking at: the sensation of the pain and the modality.
cool.
Okay, and then lastly, we come to chronic pain. So this is where, as we've said before, you'd need to consult a homeopath. And we're looking at remedies for the constitutional state. So that might mean that 3 patients with chronic back pain might all need different remedies, because we're looking at the etiology, where does it come from? How did it start? Did it start from a car accident? Did it start from an injury at work? Did it start from nothing that seemed to happen, but it happened to be quite soon after a big shock? So it just depends where it started, and then it's the nature of the pain, how the person's experiencing it, it's how it's affecting them. So, is it making them angry? Is it making them upset? Are they just frustrated? Are they depressed? So we take all that into account. So although it might be the same kind of pain, they may well each need a different remedy. And then we're looking at the consultation takes about an hour and a half. So as well as looking at the pain itself and everything we can get to do with the pain, the sensation, the modalities, and all that, everything that's linked to the pain, we're going to be looking at what is the patient's nature, how does life affect them? So how does their environment affect them? So it's how temperature affects them, how noise affects them, how emotions affect, everything that we can get in that hour and a half to find out what it is about them that makes them an individual. And then we look at what we call physical generals. So we look at how their sleep is. If there are sleep issues, what are the sleep issues? Is it that they can't get to sleep? Is it that they wake in the night? How long are they awake for? What do they do to get back to sleep, etc.? We look at their digestion. We look at food desires and aversions, which people always wonder, why does that matter? What I want to eat, what I don't want. But again, it's what the body is wanting. So we're looking at what is the state of the body at that time in terms of what it's desiring. Is it really thirsty? Is it desiring chocolate? Is it desiring lots of fresh juice, soups? What is it? What is it desiring? And aversions, things that it doesn't like. And also aggravations. So is there any aggravation from milk or tomatoes or whatever it might be?
Very, very full, detailed, full
Exactly.
line.
It's really detailed. Yeah. And people really usually really enjoy it because, who gets to talk about themselves and all their stuff for an hour and a half with nobody interrupting and talking about their stuff? So people generally, it's a really nice experience because they get just that full listen to for a whole hour and a half. And the last thing we look at their family health history just to see, is there any tendencies coming down through the family. And then we put all that together, we do an analysis. We use what's called a homeopathic repertory, which is a huge book divided into sections of, there's the mind section, and then there's the head, and then there's the stomach and the throat. And so it's divided into all those sections. And it's got all the different symptoms that we talked earlier about, those provings when healthy people took the remedies to see what happens to them. It's all of that information from all of the provings. It's all in there. So one specific symptoms. So, we talked about ailments from a grief, for example. We'll look up ailments from grief, and it'll have all the remedies that we might use. And then we look at the specifics, so, back pain, and then we look at, cutting pain, for example. And then we'll have a list of remedies that could have that symptom. And then we piece it all together, and then we'd come down to a list of about 20 remedies. And then what we do is we get a book called Materia Medica, which is sort of like this book here, these big books here. We have them on the computers as well. And that's all the different remedies listed with all the symptoms that someone needing that remedy might have. And then we choose the most appropriate one. Fortunately, we have computer repertories now, so it's quicker than having to look through all the books. Personally, I like using a repertory on the computer, so I put in all the symptoms and it makes a nice table for me with the top remedies that might apply. And then I like looking in my books, the Materia Medica, and reading and finding which one seems most appropriate. And like we've said, sometimes there may be 2 or 3 and it's difficult to differentiate. So we'll choose one, make a note of the others, and then if one doesn't help, then we give the other one. And that's just the nature of it, because there's so many to choose from that we don't always get it. We don't always hit the nail on the head the first time.
Yeah. And it might be sort of, as we were talking earlier about, you might not know the whole story of somebody.
Exactly. Often things come up. Yeah, that's a really valid point. So often things come up in the second and third consultations, which then lead us to the right remedy. And of course, people come and we've never met before. They don't necessarily feel comfortable in sharing everything right from the start. And I say to people as well, we have a thing in homeopathy, it's called the strange, rare, and peculiar. If you can find somebody's strange, rare, and peculiar symptom, then you've got their remedy. But often it takes a really long time to find that. So one of my teachers, he talks about the wonkiness. So he was saying you're trying to find somebody's wonkiness. We're all wonky, and it just depends whether that comes through in the first consultation or not. And sometimes it doesn't. People think it's too weird, they don't want to mention whatever weird thing it is.
Yeah, I mean, could that be like, I remember I had a lady who had hip problems. I mean, not with homeopathy, with my field.
Yeah.
And, as she was addressing her hip pain and other things, physical things, as the time went on, she revealed her story. And one of the early triggers was her parents divorced, and it changed her world. It triggered her from a very early state. So people sort of revealed. So would that be a wonky thing? Things
that would just be her experience, that was the start of her, sending her off in that direction. That was the thing that affected her. And she may not have been wanting to talk about that. It was just
may not even connect it, but would that be a wonky thing? Is that like a weird wonky
thing? Yeah. Or it might be something really small, but really specific. It might be that they, people have delusions that, that they, in the way that they see the world, that they might think is too weird to want to share. They might talk to spirits, or they might, that people do all kinds of things, don't they? And then they might have certain dreams that they're not willing to share because they won't worry about how that might make them seem.
Yeah.
Or, they might feel like something in nature. I was just talking to a friend just earlier today, and she was saying about how the person was talking about how, they just felt like a tree in a way, but that they weren't the tree. They were like really small, but they should be a tree. And she's like, what are we talking about here? But that really helped her to get to the right remedy. And that probably never really talked about that before, maybe even not even thought about that before. So it can be amazing what can come out in the consultation. But yeah, like you say, often it can take a few before what we need comes out. And so that's the end of my presentation. That's my last slide, Althea.
Fantastic. You did it perfectly in time, Sarah.
Oh, look at that. It's just 5:02. Yeah, gosh, amazing. No, because I didn't time it when I was writing.
You did it naturally.
Fantastic.
And so where can people find you?
So I'm based in Whitney, which is West Oxfordshire,
Mhm.
and but I work online,
Oh,
like all of us who don't need to use our hands in our therapies since COVID.
and-
We've
yeah,
started working online. So I see people all over the place.
that's brilliant because we
Yeah,
have people in pain free all over the place. So that's
yeah,
perfect.
yeah, yeah.
I'll be sharing all your contact details when I send out this recording, so
Brilliant.
people
Thank
can
you.
get in contact with you. So, what kind of things? How would people know that they need a homeopathic treatment? What kind of conditions would they bring to you typically?
Oh, anything, all sorts, because it's triggering the body to heal itself. It can work with anything. You know that the more long-standing the condition, the more serious the condition, the longer it would take. And
Hmm.
obviously, it's not always successful. There's not always guarantees, like with anything. Um, but yeah, so I've had this week just somebody come in, a little girl. Mum's parents brought a little girl with allergies. She has a lot of allergic reactions, and some eczema. And then I've just had somebody, like I said, just now with pain in the sacroiliac joint that is extending down the leg, and she's had that. She's had all kinds of investigations, but at the moment she's just having to take painkillers. Um, so that one, and then there's thyroid issues. There's people who are just not getting over the loss of something, people with anger issues, people with alcoholism, anything at all. Children tend to be easier to get back on track because they've had less life experiences, I suppose. With children, we get a lot of um, like chronic kind of nasal I can't think of the word, like rhinitis, sort
Yeah,
of
so sinuses, sinus problems.
sinuses, yeah, sinusitis, those kinds of things. Children's behavioral difficulties can respond amazingly to homeopathy, and that's something
Fantastic.
that people wouldn't think of that can be helped, and it's fantastic for that,
Yeah,
you know,
wonderful,
and people school refusers, that kind of thing. It can be just amazing.
wonderful. And a first consultation would be an hour and a half then.
Hour and a half, that's right. Yeah. And then the
And
follow-ups are about 45 minutes.
it all depends on what's going on with them, what they need, what you suggest according to what they need.
Exactly. And sometimes we need a chat during the month because we might just need to adjust the dosage or the potency of the remedy. So, I'm very happy for people to contact me and have a quick chat or a couple of emails during the month. But generally, it's sort of month to 5 weeks apart. And some people, it's kind of ongoing, if they've had a lot of stuff and they need a lot of support, and it's a gradual thing, things will get better gradually. Then, we might see them for a long time.
Mm,
And just as and when, some people come as and when. Once you've done the 3 months, they might come back a couple of months later. They might leave it 6 months, might wait till something else has happened.
yeah,
Yeah, so but it really depends on the circumstances and the condition.
fantastic. And as I said, I will be sending the contact details for how people get in contact with you and go and sort out their thing. So, Sarah, that was amazing. It's so beautifully laid out and very clear, and really took us into the depths of what is it and how does it work and what's it for. And I really appreciate that. That really filled a blank in my knowledge.
Excellent, thank you. And there's obviously lots more information out there on my website. For example, I've got a page with the basics about homeopathy, but then I've got links that go into more detail. So, if anybody's
Fantastic.
interested in finding out more, they can use that as a starting point. The Society
Okay.
of Homeopaths has got lots of information that's really accessible on their website.
Brilliant. So I'll put your website on there as well. And do you run any courses or teachings? Is it all patient to patient?
It's all patient to patient at the moment. I do festival work, so like workshops at festivals. I
Mm.
also I work with the Traveling Homeopaths Collective. So we go to festivals and we treat um, acute problems there in the festivals. We
Right.
do that as
And
volunteers. So like I go to Glastonbury most years and we do that. So that's a
Brilliant.
great experience to connect with other homeopaths
Yeah,
and get the word out there about homeopathy as well.
I
You know,
love that. I hadn't thought about homeopathy as a sort of instant fix thing, and going around sort of spreading the word and people getting an experience of homeopathy for their thing.
yeah, yeah. Oh, it's brilliant. It's
Brilliant.
brilliant. I love doing that.
Lovely.
Yeah. Yeah.
Fantastic. Okay, Sarah, fantastic. Thank you so much for sharing your knowledge. And I hope this has inspired people who are watching this recording. And do get in contact with Sarah and get your things sorted. If this is is calling you to try it out and to help your condition, your symptom, or whatever's going on for you, I'll be sending this out to the email list, everyone who signed up. And yeah, thank you so much, Sarah.
Well, thanks so much for inviting me on, Althea.